As the COVID-19 pandemic continues, doctors are still observing and learning about its effects on children. I spoke to one local pediatrician who shares the impact it can have on children beyond their physical health.
As if parenting isn't challenging enough, keeping our kids safe and healthy during this pandemic is presenting some extra obstacles. One of the many things we're encouraged to do: talk about it.
Kids really need to hear from you. They need to talk to you about it. Anything that is not talked about is more scary for them.
But first, get your own feelings in check and get accurate information. Not all concerns will come up in conversation, which is why parents should also rely on observation.
You need to really be aware of how they're doing with everything and sort of looking for signs that they're not coping well, like sleep disturbances or disruptions in their behavior.
Doctors are also seeing some red flags on the horizon as a number of mental health cases are on the rise, and it could have a lasting effect on children.
People are not taking care of themselves as they should. All of those things are affecting kids. So kids might have a mild illness, but really they are at big risk for the long-term implications of this pandemic.
Skipping scheduled vaccines is another concerning trend since the pandemic began.
We might see some vaccine preventable disease kind of spiking after this happens if they're not getting into the clinic and getting their vaccines on time.
And for the child with a big heart, helping them take action during these trying times can go a long way.
Having kids write messages or draw pictures on the sidewalk is great. Having people make masks, like those are things that kids can help with and that empowers them, and that really helps them sort of heal from this experience.
And parents are also reminded children should get at least 60 minutes of physical activity a day to get up their heart rate.